I'm Dr. Corey Liao. I'm the Director of Hawaii Pacific Neuroscience. I'm also a clinical professor at the University of Hawaii School of Medicine, John Burns School of Medicine. I'm born in Penang Island, Malaysia. Because I was born in an island, I love being around the ocean all the time. When I get a chance, I go stand up paddle. I stand up paddle surf. I really love being in the water, so I guess that's why I'm in Hawaii. I'm really passionate about making a difference in people with neurological disorder, and I am very fortunate because I feel like Hawaii Pacific Neuroscience has one of the best team, some of the best doctors, best staff, and best support to care for people with neurological condition. Because people with a neurological condition can have not just pain or not just seizures or stroke, but they can have other needs that may extend to the caregivers for patients with dementia, or perhaps, so I feel like it really takes a whole village or a whole multidisciplinary team to really make a difference. So we feel very fortunate because patients can just come to Hawaii Pacific Neuroscience, one-stop shop. They can see the neurologist, they can see the geriatrician, they can see the social worker, they can see the nurse practitioner for counseling, for brain health wellness, for care coordination. They can see the neurosurgeon, they can see the psychologist for agitation, for counseling, for anxiety, depression, and they all work together on the same team. They all talk to each other. They don't have to go to different parts of town, different doctors. So I feel very, very fortunate. This is really a one-stop shop for people with neurological condition. Patients with epilepsy can have some different challenges and needs. It's not just about taking the medicine or what kind of medicine. It's about really making the right diagnosis, because having the right diagnosis first and foremost will determine the treatment moving forward. Some patients may not even need medications, and we don't want to put them on seizure medications if they don't need it, or we don't want to put them on too much seizure medicine or the wrong seizure medication. Therefore, even before we talk about what to put them on, the need is to make the right diagnosis. At Hawaii Pacific Neuroscience, we have a team of doctors and the state-of-the-art diagnostic tool, including epilepsy monitoring unit, video EEG to make the most accurate diagnosis. This is an overnight study that patients can come in and have the wires hooked up to their brain to allow us to make the correct diagnosis. And once the correct diagnosis is made, we will mobilize a multidisciplinary team, which will include a neurologist that specializes in seizures or epilepsy in both adult and pediatric, and also psychologists to deal with perhaps patients could have anxiety, depression with their epileptic seizures, and also to put them on the right medications and also the right amount. Some patients could be on way too much medicine or they're on wrong medications. We want to change that and get them to the right medications. Sometimes we also realize that a patient may not need to be on medication. They may have other things other than seizures, so our job is also to take them off the wrong medication. But obviously, there are patients who seizures sometimes are not controlled on medications or on multiple medications. Our job is to look at other non-medical therapy. Sometimes it could be a device like a vagal nerve stimulator, or it could be surgery that we could utilize for the difficult to control seizure patients. Should the options be right, we are also the only center to offer research treatments that are not available anywhere else. We are doing clinical trials along with big centers like Cleveland Clinic or Mayo Clinic on the mainland to offer cutting-edge, groundbreaking epilepsy treatments that they may not be able to get anywhere else. So I would like to encourage my patients to keep seeking answers. Don't let anybody tell you that there's nothing that they can do. There's always something that we can do, and we do want to make a difference. Our goal at the epilepsy is to really improve the lives of patients with seizures so that they can go from having frequent seizures, disruption from their work, disruption from their life, losing their independence, not being able to drive, to getting them back to the normal life where they can get back to work, being able to drive, not so tired, not so drowsy because they're off the wrong medicine and on the right medicine. That's really our goal, to improve their quality of life. And also we do take care of patients who are pregnant with epilepsy, special population, adolescent, epilepsy with depression, epilepsy, non-epileptic seizures. These are our specialization, and we would really like the opportunity to help our patients.